Amy was a 46-year-old patient who had suffered from digestive issues for over 15 years. She had frequent loose stool, bloating, burping, and cramping. If this sounds familiar to you, please stay tuned as we not only diagnose Amy's condition, but we go in depth about her treatment plan. Hi, I'm Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, and registered dietitian, and I am super passionate about helping you heal your body and live with vitality. That includes everything from alleviating pain, regulating your nervous system, optimizing your nutrition and gut health, of course, which we're going to talk about today. So let's get into Amy. So Amy is a mother of 3 boys. She's had 3 C-sections. She is quite busy because she is trying to raise her family. She's working full time. She also admits that she's a little bit of a perfectionist. And so therefore, all of this, including working full time, is really causing a little bit of anxiety. Another concern for Amy is that she has been noticing more and more hair loss and hair thinning, and she noticed this more when she was diagnosed with SIBO. While following her FODMAP diet, she does report that it is quite restrictive. She is eating chicken and vegetables, typical low FODMAP or fermentable carbohydrates. She's trying to avoid gluten and dairy, but she's just feeling like this is really challenging. She did have a colonoscopy 4 years prior, and she also was tested for celiac, which was negative. However, one of her markers, the tissue transglutamase, was elevated. So let's go back to looking at Amy's symptoms. So let's remember that she was experiencing diarrhea and bloating and cramping and burping. As many experience with SIBO, she had been diagnosed with IBS and she had been seen by multiple providers. Additionally, she was given 3 rounds of antibiotics without any success. So this is what led her to the FODMAP diet, but unfortunately, because it was so restrictive for her, she did lose 10 pounds over the course of 3 months. Her BMI was only 18, and she just felt like this was not sustainable. So how did we test and diagnose Amy? So number 1, we looked at a stool test. In this case, Amy was not able to do a comprehensive stool test just because simply of the finances at that time, which a comprehensive stool test is going to look at everything from pathogens to our opportunistic bacteria, our commensal bacteria, infections such as H. pylori, and as well as intestinal markers such as inflammation in the gut, potentially signs of leaky gut, how you're digesting your food. But in this case, we were able to look at specifically H. pylori because Amy was experiencing things like burping and some upper GI issues as well. That can also be a symptom of H. pylori, and we want to rule out any pathogen, especially as it relates to a bacterial infection. In this case for Amy, H. pylori from a fecal stool test was negative. Next, we looked at a SIBO test for Amy. And so when we're looking at a SIBO test, this is a breath test, which is going to be one of the most valuable tests for identifying which type of gas, or even if it's a mixed gas, that's produced in the small intestine. So essentially with the SIBO test, you follow a preparatory diet the day before, you're fasting the day of the test, and you're drinking something called lactulose. What you're doing after you ingest the lactulose is over the course of 2 to 3 hours, you are measuring the amount of gas that is being produced and in the form of hydrogen, methane, or hydrogen sulfide. This gas that is produced and expelled ultimately by the lungs is what we're using to detect SIBO and the rise of it within a certain amount of time. So if it begins to rise before 90 minutes, then we know that we can identify where in the small intestine it might be happening. Is it more proximal, so towards the head, or is it more distal towards the colon? So in Amy's case, we saw that there was a hydrogen dominant SIBO, which is very consistent with her symptoms. This is often associated with the diarrhea and the more bloating, and is more consistent with the area of the ileocecal valve, which is where our small intestine is moving into our large intestine. So from a lab perspective, we want to do some of the basics, of course. So a CBC and a CMP, so a complete blood count and a complete metabolic panel. We also, of course, looked at thyroid because we know that thyroid function can affect motility. We also, of course, looked at some basic nutrients, things like vitamin D, iodine. Iodine can drive thyroid issues. We also looked at zinc, a lipid panel. We found that Amy had low T3, so she also had low iodine. So low iodine can affect the production of T4, which ultimately converts to T3. So she had low T3, she also had low zinc and vitamin D. So this helps give us a better picture if she is malabsorbing any nutrients which are happening in the small intestine. So the longer that SIBO persists, that can contribute to ongoing nutrient deficiencies. Now that we know a little bit more about Amy's case and we have some more objective data, we can get into her interventions that we use to help her heal her body. Now, she was a little bit anxious about everything. She has been through the gamut of treatments and practitioners and antibiotics. So of course we have to take all of that in consideration and go slow and methodically to help her feel comfortable in her journey, but also, of course, to get her feeling her best. So number one, we wanted to optimize thyroid function. So the first thing that we did was include iodine drops to support thyroid function. We also included foods that contain zinc, such as pumpkin seeds. So this was a nice way to help our conversion of T4 to T3 as opposed to reverse T3, which can cause a lot of havoc on our system. The second thing we did was address digestion. So the first aspect of that is focusing on your own practices. So for Amy, we encouraged her to do some diaphragmatic breathing before her meals, chewing her food 20 to 30 times, really trying to make sure that she was in a true rest and digest state before she began eating. But we also supplemented with some enzymes. So we used pancreatic enzymes that help to break down her food as well as hydrochloric acid. We did the due diligence of doing a self HCl test and realized that she needed approximately 1 betaine HCl with each protein containing meal. That was approximately 3 ounces worth. Although Amy did do antibiotics before, we did feel like this was the best path for treating her hydrogen dominant SIBO. So she did do rifaximin for 550 milligrams 3 times a day for 2 weeks. We did this along with partially hydrolyzed guar gum during the duration of the antibiotics. Typically, one treatment is not enough for SIBO, so we also did an herbal antimicrobial. So in this case, we did 4 weeks of emulsified oil of oregano as well as berberine to treat the hydrogen dominant SIBO. And lastly, one of the most important things is because Amy was losing weight from the FODMAP diet, we really wanted to begin to reintroduce the FODMAPs, not only to improve her overall health and well-being and nutrient intake, but also to eliminate her fear of food that she has had for so long. So we began to slowly reintroduce one at a time and identify which FODMAP issues were still an issue for her so that she could really expand her nutrition. At Amy's 6-week follow-up, she unfortunately was only having mild improvements, but she was still having severe abdominal pain, especially in the morning, and it was relieved when she had a bowel movement. So this gave us some insight that she was still having a significant dysregulation of her gut-brain axis and that anxiety and vagal tone was definitely playing a role. So Amy did NERVA's 6-week program to rebalance the gut and brain via hypnotherapy. She continued to do the digestive enzymes and the HCl, especially because stress was really still playing a role in her gut dysregulation, SIBO symptoms, because when we are in a fight or flight state, we have blood flow that's moving away from the digestive tract. We also began to give Amy some anxiety soothing herbs. So this included things like kava and lavender, passion flower, and she began to ramp up this slowly from a small amount of drops per day up to about 30 or 40 drops per day. And of course, we wanted to give her some vagus nerve exercises. So things like humming and chanting and gargling. These are really simple practices that help to really begin to tone the vagus nerve, improve her overall resiliency, and improve this gut-brain connection. And of course, we continued to introduce FODMAP foods. This was challenging for Amy because when she did, sometimes she had symptoms. So we just began to continue that journey of introducing at a pace that she felt comfortable with. At Amy's 2-month follow-up, she definitely was reporting improvement, especially as it related to all of the vagus nerve exercises and helping her with regulating her anxiety and stress. However, she still was having difficulty with reintroducing the FODMAPs. Her bowel movements were more regular, so that was great. However, she still wasn't really able to expand her diet as much as we both would have liked. So at this point, we wanted to, of course, continue the vagus nerve exercises, continue with focusing on optimizing digestion, continuing to focus on the anxiety soother drops. And in addition to that, now we wanted to really work on healing the gut lining. So in order to do that, we used a GI Resolve powder that has aloe, that has glutamine, zinc carnosine, MSM, DGL, and okra to help support and heal the gut lining. So as I mentioned, when we have SIBO, what can happen is it begins to really break down the integrity of the gut lining, affecting how we're able to absorb the nutrients. And so this can help, all of these nutrients can help support the gut lining, ultimately to allow her to be able to continue to reintroduce more foods. At 6 months, Amy was feeling much better. She was able to regulate regulate her stress. She felt like she had much less symptoms as it related to the bloating and cramping and abdominal pain. Her bowels were much more normal. So she began to decrease the anxiety soother drops as she felt comfortable. And 8 months later, after her treatment, she felt ready that she could retest. Her symptoms had really resolved. Her hair was growing back. She was feeling so much better. She was a little nervous about testing, but when she got the results back that she truly had a negative SIBO test, she couldn't be more ecstatic. The number one thing that I'd love for you to take away today is to use Amy as an example, that you too can heal your body from SIBO if you have a proper diagnosis, you understand the tests that are associated with understanding your underlying causes of SIBO, and then be able to have a systematic and sustainable plan to work you towards a path of healing. If you want more videos like this to improve your health, please like and follow to stay on the cutting edge of root cause medicine.